Another common question that I get asked during consultations is if a patient's come in and concerned about the appearance of their nose, sometimes they'll just be bothered by, let's say, a bump on their nose, or they think their tip is a little bit wide. And they want to know if they can just address that single issue. And the answer is technically yes, you could just remove a person's bump on their nose or make the tip of their nose smaller. However, that will not give the person the best result. Most commonly, and one of the reasons why rhinoplasty is one of the most difficult procedures, is that each thing that you operate on, for instance, removing a bump, does more to the nose than just remove the bump. If the bump is removed, the bridge looks flatter and wider. And so to compensate for that, you have to then break the nasal bones to narrow the nasal bones and make the bridge the normal width again. So when looking at a person's nose, as a plastic surgeon, as with most parts of the body, you have to think of what's beneath the skin, and when you do something to one part, it affects the entire appearance of the nose. So to give the most natural result, usually you'll do something to each part of the nose. For instance, a very general description would be lowering the nasal bump or bridge, narrowing the nasal bones, narrowing the tip to keep it in proportion to the nasal bones. When you lower the bump, the tip sometimes drops, so then you have to lift the tip a little bit. So we have to listen to what the patient is interested in and concerned about, but then instruct them on what procedures would give them the best and most natural look.